Welcome back. I'm Jack Burns with the Mount Crescent Ski Patrol in the Rocky Mountain Division. And in this section, we are going to talk about the 3 stages of shock. The 3 stages of shock are compensated shock, decompensated shock, and irreversible shock. We start with compensated shock. In times of stress or decreased metabolic demand, the body activates various compensatory mechanisms to help restore homeostasis. These mechanisms can only function for a while unless the problem is corrected. An example is a decrease in the amount of blood in the system or a decrease in the amount of oxygen reaching the cells. A signal from the brain can stimulate a release of epinephrine, which causes the heart to contract more quickly and the ventricles to contract more forcefully with each contraction. This increases the stroke volume, which increases the blood and oxygen to reach affected tissues. In addition, blood vessels in the skin and extremities constrict, which redistribute blood flow away from these structures and toward the vital organs. As this is happening, signals from the brain cause both the rate and depth of respiration to increase, to bring more oxygen into the body and to expel more carbon dioxide. This combination of tachycardia and tachypnea, along with increased peripheral vascular restriction, helps to stabilize the internal environment, at least temporarily. It is important to know that compensated shock can mask gravely serious conditions and give the false impression that the patient is less sick or less injured. The first pieces of evidence that a patient may be in shock are tachycardia, tachypnea, delayed capillary refill, cool skin, altered mental status, Glasgow Coma scale of 15 or less, an A in ABPU, and a normal blood pressure. Treated early, compensated shock is correctable and generally there are no long-term lasting effects. However, untreated, this shock will progress until the body is no longer able to compensate. The next stage is decompensated shock. In decompensated shock, these methods of compensation begin to fail. The systems of the body are unable to improve perfusion any longer, and the patient's symptoms reflect that fact. Oxygen deprivation in the brain causes the patients to become confused and disoriented, while oxygen deprivation in the heart may cause chest pain. With quick and appropriate treatment, this stage of shock can be reversed, but serious complications can result. And finally, the last stage is irreversible shock. In irreversible shock, the length of time that poor perfusion has existed begins to take a permanent toll on the body's organs and tissues. The heart's functioning continues to spiral downward, and the kidneys usually shut down completely. Cells and organs and tissues throughout the body are injured and dying. The endpoint of irreversible shock is the patient's death. On page 336 in the Outdoor Emergency Care 5th edition is a diagram of the continuous cycle of shock. Review this figure in the book and compare it to the stages of shock that we just covered.